Good morning, class. I'm sorry.
Did she just
Good
fall?
morning. I've just been rushing. Good morning.
Somebody come get y'all teacher.
Not Mr. I am Mrs. Slickenberg, or Mrs. S, or Professor S, and I will be teaching Haemophilus Influenza 1101. Hopefully everyone's in the right class. So since it's the first class, I would do greetings, but I don't know if you guys are up to it.
Do not pick me. Do not pick me.
Okay, well, it's nice to meet all of you. Today we're going to be talking about Haemophilus influenza. Isn't that ironic that that is the name of the section? I know, right?
Yeah, very ironic, but I don't think it's funny.
Influenza. Does anyone know what it is? Does anyone know what Haemophilus influenza is? Oh, you right there. You in the black shirt. Well, thank you, Professor S, for picking me. According to my reading, prior to coming to class, you have to be prepared to come to class. Haemophilus influenza is the gram-negative cocoa bacillus. It is recognized as a major cause of serious infection and mortality in children less than 5 years old. It is a facultatively anaerobic pathogenic bacterium, and it belongs to the Pasteuriliaceae family. It was founded in 1892 by Richard Pfeiffer. Yes, I believe that's the answer. Ah, you are correct. Miss Erica?
She done forgot the
Sorry,
girl name already.
I forgot your name. It's the first thing. But you are correct, Miss Erica. Haemophilus influenza is an amazing habit. All right, thank you, Miss Wazowski, for that wonderful, wonderful answer. And I really am thankful that you decided to read prior to coming to class, even though it's the first day of class. Thank you. Class, I would love if you guys would start reading before you come to class. That way you're familiar with the information that we'll be talking about in the lecture of that class day. Anyway, as we move on, we will be talking about, what Haemophilus influenza can cause. And people don't know that it can cause a lot of things. It can cause epiglottis. It can cause arthritis. It can cause pneumonia. It can cause, what else can it cause? It can cause bacteremia. It can cause different type of things. And a lot of people don't know that just having the disease is the easy part. But what the disease causes, which it causes multiple other invasive disease, is what they should be scared of. Now, class, I really want other people to participate, but I want someone to tell me how does influenza get spread? I know. I need you to tell me, how does influenza get spread? Haemophilus influenza at that. Anybody?
Girl, put your hand down. Put your hand down.
Just anyone else? Go ahead, Miss Wazowski. Would you mind? I'm pretty sure you know, but would you mind telling us how Haemophilus influenza is spread? Thank you, Professor S, for picking me again. Just to remind you that my name is Erica Wazowski. And I just wanted to say that
be reminded of that again and again and
Haemophilus
again.
influenza is spread through different ways. People can spread it through respiratory droplets, which if many of you don't know, respiratory droplets are like when you sneeze or when you cough, or
because she keep taking up
when you have
all the
bacteria,
class time
in your
one
nose.
question.
Also, that's pretty much how influenza is spread, and it's spread through close contact with another person. Thank you, Miss Wazowski, again for answering another one of my questions. Now, class, I get it. You guys may not have read prior to coming to the first day of class. I get it because it's the first day of class. But you have to remember that answering questions in class, or even trying to answer questions in class, go towards participation points that you need in order to pass the class. Now, Ms. Wazowski has gotten enough of her participation points today, and she only answered 2 questions, but still those questions were just from her reading prior to coming to class. I would like it if I could get more responses for these next classes, because for these next questions, I apologize, because these next questions are kind of easy. So obviously we have learned of what I've said before, that Haemophilus influenza can cause many different kinds of infections. Like I said, it can cause pneumonia, it can cause meningitis, it can cause bacteremia. So my question is, what are the signs and symptoms? How do someone know that they have contracted one of these infections that have been caused by Haemophilus influenza? Now, mind you, you have to remember that the symptoms all depend on what what body part has been infected. So you have to remember, if I have pneumonia, if I had pneumonia, what will my symptoms be of pneumonia? Because pneumonia is caused by what? Haemophilus influenza. So I would like someone to ask, or to, tell me, what do they think of the symptoms? What are the symptoms and signs do y'all think are connected with Haemophilus influenza? And I don't need no smart answer. And excuse me, sir. Excuse me.
Man, come on, man. Yes, can I help you? Hey, can I help you?
Could you please remove your feet from off the empty desk that's in front of you? Because I don't know who raised y'all. Even though y'all grown and y'all in college, you don't disrespect FAMU's furniture, okay? Now, since you want to disrespect FAMU's furniture and want to act like this classroom is your home, you can answer my question. What are the signs and symptoms of Haemophilus influenza, sir?
First of all, I'm a girl, so I'm male. I just ain't got my head done today. My mama forgot to put some money in my account so I could get some feeding and braids for the first day of class, so I wasn't able to get my hair done. But anyways, and my name is Denasia Brown. And to answer your question, well, like you said, it all depends on the body part. Not only the body part, but it all depends on what kind of infection did you get from Haemophilus influenza. So if you got pneumonia, you feel me, you may have symptoms such as fever, cough, sweating, headache, minor stuff like, excessive tiredness, because pneumonia is nothing but a lung infection. Now, if you have something like bacteremia, then you may have, chills, you may have pain in the belly, you may have diarrhea, you may have anxiety, and you may have altered, mental status. You may be confused most times. But bacteremia, like I said, that one is an infection in the bloodstream. So it makes sense that it would mess with your diarrhea. It makes sense that you have pain in the belly. Now, if you have an infection like meningitis that has been caused by Haemophilus influenza, then maybe you'll have a fever, maybe you'll have a headache, maybe you'll have a stiff neck. And actually, a lot of people don't know, but you'll also have photophobia, which means that your eyes will be more sensitive to light. Meanwhile, because the meningitis is an infection of the tissue covering the brain and spinal cord, so brain, fever, headache, that type of stuff goes with the brain. So, Miss S or Dr. S, you thought I didn't know what the symptoms and signs was, but I do. Next question.
Well, thank you, Miss Denasia, for that sassy yet very correct answer. That was a very good answer. And you are totally correct. Like I said, the symptoms all depend on the different infections, on what kind of infection that was caused by the Haemophilus influenza, and also
what body part was infected by having that specific infection. So like she said, for meningitis, it deals with the tissue coverings of the brain and the spinal cord. So therefore, you're going to have fever, you're going to have headaches, you're going to have sensitivity to lights because that is close to your eyes and things of that nature. So thank you, Denasia. And I really hope that, by attending this class and getting participation points, and by me putting you coming to class on the computer, you'll get your net check on time in order for you to get those feed-in braids that you needed on the first day of class. And I'm sorry for mistaking you for a man. Next topic we're going to talk about while we're talking about Haemophilus influenza is we're going to talk about class, the diagnosis of it. There's always, you have to get diagnosed with something in order for you to know that you have it, right? So we're going to say, how does the doctor know how to diagnose you? What are ways that you are able to get diagnosed with Haemophilus influenza? You've already figured out what it causes. You already figured out, the symptoms of what it causes. Now you need to figure out what exactly what kind of tests are used to diagnose Haemophilus influenza. You're right there. You with the phone in your hand. You. Oh, are you talking to me? Oh, hi everyone. I'm Princess Wilson, and yes, my name is really Princess. And what'd you ask me? Oh, you asked me the diagnosis, right?
Yeah, duh.
Okay,
We all good to
so
hear your answer. You take it first.
diagnosis. It said, well, what I learned was that in the diagnosis, it says that basically, you have to take one or more lab tests in order to figure out what the diagnosis is. So, I learned that, some lab or some methods that they do is they use a sample of body fluid, such as the blood or spinal fluid. So they use blood or spinal fluid to test for, to run tests on to see whether or not you have Haemophilus influenza. Thank you. Well, thank you, Princess Wilson, is it? Well, thank you, Miss Wilson, for answering the question about the diagnosis of um, Haemophilus influenza, even though you looked on your phone the whole time.
She never satisfied.
But thank you anyways for
Can't wait to get up out
questions.
this class.
Now I will provide a picture to you all, I know finally, of how this bacteria, the Haemophilus influenzae, actually looks, so you guys can get familiar with how it looks, because the picture may be on an up and coming test.
Oh, that's so sad.
Okay, so class, as you can see, not only did I include how Haemophilus influenza looks under a microscope, I also included some pictures of an infant, and that infant suffered from Haemophilus influenza, or suffered from an infection that was caused by Haemophilus influenza, which was colitis of the foot. And he also got a disease of some sort connected with his eye also. So that infant suffered from colitis of the foot, which was caused by an infection that was caused by Haemophilus influenza. So you see the interaction of how it's like an effect, a domino effect. So now we're going to talk about the treatment, and also the prevention of Haemophilus influenza. So for treatment, Haemophilus influenza can, in some non-severe cases, can be, let's say, can be treated with antibiotics, and they may be required to take the antibiotics up to 10 days for the treatment, depending on how severe the infection is. People may have to be hospitalized. Some other treatments may include breathing support. They may have to have a machine that may support their breathing. Also, medication to treat low blood pressure, because maybe the infection that they got from the Haemophilus influenza may have caused high blood pressure, and also wound care for parts of the body with damaged skin. As you can see, the picture that I showed you on the slide, it showed how the baby's eye was kind of swollen and kind of red. So that could be one of the treatments. The baby could have some type of wound care to the eye if the eye gets so infected that it has been damaged. So those are some of the treatments of the Haemophilus influenza. Now for the for some of the preventions of Haemophilus influenza. So some ways that you can prevent Haemophilus influenza are vaccine, reinfection, and also preventative antibiotics. So for vaccine, everyone should know what a vaccine is. A vaccine is basically, where I would say where it kind of puts some of the disease or some of the infection into the body, where the body can have time to fight off the infection. So that way your body gets immune to the infection, and therefore when we may have like a Haemophilus influenza outbreak, you have the vaccine, so you will be protected from that. So you could also get a vaccine to prevent Haemophilus influenza disease. And then you also have reinfection, which means some people get the Haemophilus influenza more than once. So therefore, some people recommend that you get an HIV vaccination for children that are younger than 2 years old who've had it before, because 9 times they won't get it again. And then you have preventative antibiotics, which preventative antibiotics are just antibiotics that help to prevent the Haemophilus influenza, because Haemophilus influenza can spread to people who have close or lengthy contact with the person with the person who already has the disease. So in certain cases, some people with close contacts of someone with the Haemophilus influenza disease should receive antibiotics to prevent them from getting sick. So, and that's something that a doctor would recommend to a patient. I'm not sure about whether you have to get a prescription for those antibiotics, but I'm pretty sure your doctor will recommend it or should recommend it just to be on the safe side. So those are some preventions that may prevent you. And then also going back to treatments for it, not all treatments work. So even if a person is hospitalized and that may fix them, or is hooked up to a breathing machine that may fix them, Haemophilus influenza can result in death or severe hospitalization. So just be aware that Haemophilus influenza is a disease that should not be taken lightly. It should be taken very serious, and just know, don't freak out, but yes, it can end in death. So you just have to make sure that you're taking good care of yourself, you're getting the vaccines that you need, vaccinations that you need, and that anyone close to you or anyone that you may be close to that you may suspect that has Haemophilus influenza, please get them into a doctor's office as quick as you can to get them treated for it or get them diagnosed with it. Well, class, I have went over everything that I possibly could about Haemophilus influenza. I feel like we talked enough about it. Please be prepared for our test. To lectures from now that will be all about Haemophilus influenza, everything I've talked about, whether it's treatments, whether it's preventions, whether it's diagnosis, whether it's signs and symptoms, whether it's just plain old history about Haemophilus and what it causes. Please be familiar with it. You will have a test on it. Next week, which is two lectures from now. I don't want to hear any excuses. If you need any more information on Haemophilus influenza, you can email me, see me in my office hours. If not, you can always ask your classmate, Miss Erica Wazowski, and she will gladly, I'm pretty sure gladly answer any questions that you may have. But it is now 2:15. My bad, not 2:15. It is now 2:10, and I am letting you out a whole 5 minutes early. So go ahead and grab a late lunch or whatever you got to do, and I hope to see you next class period. Bye.